So good afternoon. Good afternoon. My name is Shazia Khan, and thank you for attending the session today. I'm just going to introduce a little bit about myself. So I actually have been teaching for the last 18 years, and I've been teaching different areas around the subject of law, okay, and also business and health and social care as well, okay. So if there's any questions you need to ask, just make sure you ask them as we're going. So thank you for attending Segun, and the unit you're doing today is unit which is on working in partnership in health and social care, a level 5 unit. Is that the right unit, Segun? Yeah?
Yeah, that's the right one, yes.
Excellent. So I'm just going to go through briefly with you, and this is a tutorial. So if you need to ask any questions, again, my name is Shazia Khan. You can ask me any questions anytime. So the unit specification is there's actually 5 learning outcomes. There's 4 learning outcomes and the assignment discussion. Okay, so this is the unit specification, which I'm just going to go through with you, so you've got a little bit of an idea of what we're doing in each learning outcome. So the aim of the unit is to provide you as the learner with the underpinning skills and knowledge to develop productive and new partnership opportunities working with their own and other organizations. So it's looking at elements of, things like, external organizations, understanding the difference between partnerships, partnership working and things like that. So the first learning outcome, which is learning outcome 1, which I'm going to go with you in more detail in a little bit a while, so at least you've got a little bit of an idea. First one is to understand the features of partnership working. Second learning outcome is to understand how to establish and maintain working relationships with others. Thirdly, to understand how to evaluate partnership working. And fourthly, finally, to know how to work with others and support organizational innovation and growth. And the assessment to achieve a pass. So for this unit, you will get a pass or a refer fail, and you would have to do a 3,000 word essay for this. And I'll go through everything. This is the indicative reading list and the additional resources, okay? So I'm just going to unshare this with you, and I'm going to share the, I'm going to share the new share, is the learning outcomes, so that we've got a little bit of an idea what we're doing, okay? So the first learning outcome, can you see this, Segun?
Yeah, I can, yeah.
It says working, the first one is understanding the main features and outcomes of partnership working. The unit aim is to provide you to develop your skills with productive partnership working with your own and other organizations. So understanding partnership working. Partnership working has been around for about 40 years within health and social care. And, there's a single system of full integration, and partnership working is directly out underlining the welfare system. In the 40s, the legislation set up the welfare system between differentiating between people that are disabled and people that require more assistance as well. So why do you think the legislation was set up back then to look at elements of people with disabilities? Why do you think there was a need to separate that? Second, why do you think that it was important to separate, the element of, having issues of people working with disability? Why do you think that there was new laws set up for that?
I think just for them to have a more focused care, and what's it called? Individual centered care.
Yeah. So, they don't offer the same care for people. Do you understand? So, if you're disabled, your care will have to be different for you. And they had to take all these legislations into place, and also because maybe also at that time there were forms of discrimination, even at this point as well. People with disabilities were discriminated So laws had to come into place, which is legislation, to try to protect these individuals, okay? So understanding partnership working. So partnership working in health and social care involves like collaborating with different people. So it could be different organizations, it could be different professionals as well, you know, collaborating with different services within the NHS. It might be, you know, and looking at elements of the working structures and making sure, you know, that you are working with different sectors as well. And then in 1997, Tony Blair, the Prime Minister at that time, made some, in his manifesto, promised that he's going to build the NHS and spend more on the patient care, to better a welfare system and a community care within the UK, because, you know, there were issues with the NHS, you know, and making sure that they're working with other organizations. Why do you think it's so important to work with other organizations?
So there will be when there is integration, it brings about it allows the service user to be able to access different different supports within one organization, with different teams in it.
Yeah, you could have second, you could have, you know, shared goals, and you could have things like, you know, communication between different different working environments. Also, you know, resources, you can share resources, can't you? So it does help. So the delivery was focused on partnership working, not only between health and social care, but also service users themselves. And this was in the white paper in Shifting of Balance in 2001. And they set a strategic plan, NHS plan, to look at the role of health rather than social, and how this emphasis was made on modernizing, you know, the system to make it better for everyone and make sure they build this community. So each health authority is obliged to produce a HMIP system to set strategic framework on how the services work, and how they come into working with the local authority as well. So what is the importance of partnership working? It's important because it enables professionals to build this relationship together and communicate things together without any sort of barriers, and try to break down these barriers so that they can work well together. Partnership working across health and social care is seen as being the heart of providing seamless care and avoiding fragmentation. So there has been a major shift, and, you know, new outcomes framework for performance assessment of adult social care was introduced in 2006 to make sure they deliver a service and make sure they address issues and try to collaborate with other organizations as well. Outcomes for professionals. So professionals involved in partnership working report that they enjoy it and they find it rewarding. For those involved in developing new working approaches is an element of job satisfaction. And also there are studies to show that there are people that gain confidence and work well. For these learning outcomes segment, I'm going to go through them quite quickly and then go on to the assignment discussion, okay?
Yeah, that's fine. Yeah.
So just if there's any questions or anything, just ask as we go along, okay? So negative impacts. There are a number of negative impacts that arise from partnership working. It could be the expansion of new roles within a team. That would cause problems, wouldn't it, with other team members if there's more roles within the team?
Now, what do you mean?
Lead to confusion.
If there's more role within the team?
Yeah, and you know, there could be a role demarcation, you know, between different partnerships. You know, could be a problem as well for people. And you know, when new roles come in, people do get confused on, you know, what's going on.
Oh, okay.
Yeah. So outcomes for service users. So the improvement of services. So for any service users, all the services would get, you know, new services would come in, you know, and also, you know, they'd be found improve services for the client, so it'd be really good for them. Also better access to services, you know, it could change, it could become easier, it could become quicker, and the impact, you know, it could be easier for them and there'll be more developments for them. So, you know, there are good outcomes for that. 1.1, describe key elements of partnership working. So external organizations, colleagues, the individual, and families. So working together to achieve the joint agreement is working together to achieve this goal, to make sure that you are, you're working across national and local regions, and making sure that you're providing resources and sharing services. This is this joint agreement. Why do you think good communication is really important? It's really, really important in anything. But why do you think good communication is important?
It removed the barrier of information being shared,
yes,
across the professionals.
So being open, being honest, and regular communication is really essential to build that trust, isn't it? And
Yes.
prevent any sort of conflicts or anything. And communicating regularly, maybe through patient records, through care plans, attending regular meetings is really good. And you need to be open and honest about these things as well. 1.1, describing elements again, having a strong leadership and trust parties is really, really important to have a strong leadership and trust between partners, because, you need to work together as organizations and as services. You need to build this strong leadership and make sure you build a strong rapport between each other. So you have this element of trust, and you can work together, because if you don't have the element of trust, you can't really work together, can you, Segun? You need to be working in a strong leadership team. So Health and Social Act 2012, it was a clinical commissioning group. The whole point of this was to reduce inequalities between patients with respect to ability to access health services. Also, again, like we said, you need to be open, you need to be clear, you need to be able to communicate so that you're sharing your values and your goals, and you're allowing for better information to be shared and effective. There needs to be consistency to avoid any sort of duplication, and you need to make sure that you are all open and honest about what is going on, and having these shared goals helps you improve and get that final goal. 1.2, the importance of partnerships. So partnership working in health and social care is the collaboration of all services working together, and it's there to improve within the system, make improvements, and where services need to be looked at, they put in treatment plans and better outcomes for them services. So the partnership working has led to better outcomes. So these could be the service user is now central to the care plan. An American psychiatrist, Dr. George Engel, first expressed the need for a new medical model in 1977. So, he believed that to examine all areas, including body-mind interactions, being independent and not independent of anyone else. So that's something that was done in the 70s as well, but didn't really come about. So the biophysiologist needs of patient. So first the biology, then physiology, health, social context. So things like the biology would be gender, physical illness, disability, gender, genetic vulnerability, immune function, neurochemistry, stress reactivity, and medication effects. And then the psychological, which is learning, memory, attitudes, their personality, what their emotions are, their past traumas. And the social context is the family background, the culture, the education, anything like that. So there is a mutual respect for each multidisciplinary teams as they work together and get trained. They learn from each other. They become problem solving, and there's wider collaboration with different services, and they work together like care workers, maybe social services, the police. It could be psychologists, it could be therapists, it could be anyone that works together to collaborate to build this mutual understanding against each other. Additional funding, mutual advantage, and resources. Resources are really important to develop any sort of training needs or anything like that, to meet requirements. Different services working together, and voluntary sector has an involvement, so community services. 1.3, how to overcome barriers in partnership working. Barriers to partnership working may be the need of, having mutual respect, And it could be barriers. There are lots of barriers about the level of recognition, the role of care homes play in managing. It needs to be an emphasis on building this good quality relationship based on trust and greater equality. So overcoming these barriers, what do you think could be a barrier in that? What do you think could be a barrier? Second, do you think organizations not getting on could be a barrier? Poor communication, could that be a barrier as well?
Yeah, that's a massive barrier, because
Yes, it'd be a huge barrier that, yeah.
if there's a poor communication, that means passing information from one
Yes,
person to another will be difficult, or
yeah,
if there is duplication in the information being shared, then
yeah,
that's going to have a negative impact on the care plans for, or care that's
yeah,
being given to the service
yeah.
user.
And these any sort of like, resistance to change, people don't always want to change. Do you know what I mean? So these, and try to overcome these barriers is having this working relationship, making sure you're sharing education, you're sharing training and improving your service. And overcoming these barriers, again, like we said, effective communication is really essential part of it. Staff feel isolated if they don't have good communication. So communication is a key part of it. Sharing things, trying to build things together, working with different agencies. Inclusion of views of patients and carers, and that's really important in the communication part of it, making sure that staff are helping the service users, and carers are building this relationship with different organizations. Engaging families, making sure that families are part of the communication, part of the treatment plan, part of the care plan, and challenging any sort of discrimination, making sure there's no ethical discrimination. Everyone is treated equally, be it doctors, be it nurses, they all should be treated the same, and make sure that their roles are, equal. 1.4, explain how to deal with conflict that may occur in partnerships. So conflict could be bringing, the whole goal is to empower the quality of services provided. There must be trust between the two partners and a working relationship to make sure there are no consequences together, that they can't work together. How to deal with these conflicts, reduce barriers, make sure that there's equality, make sure that you're providing a good service, and make sure there's good communication between everyone, and there's resources available for them. So the holistic approach is it provides support that looks at the whole person, not just their mental state. So it looks at their emotional, physical, social, environmental, occupational, spiritual, intellectual needs, and looks through them. The person-centered care is at the heart of everything. So you've got the person-centered care, where it looks at supporting independence, honors the individual's choice, improves the quality of life, empowers residents, enhances dignity, and promotes well-being. There's a video there on person-centered approach that you could have a look at in your own time, and it looks at the element of the person-centered care and looks at day-to-day care in regards to how training needs are required. Okay, so have a look at that video in your own time. So
Yeah, I don't think I have this kind of slide. Sorry to override you. Yeah, I don't think I have this kind of slide in my own.
I can send you them, second. If you send me have you got access to Moodle?
What's Moodle? Okay, yeah. I've got access to that.
So this is all on. This will be all on Moodle.
Yeah,
but what I can email it to you as well, second. Okay, if you send me your email address,
I will.
And at the end, I'll email it. Okay.
Oh, okay. Thank you very much.
So the recording will be on Moodle for you, though. I can't send you I don't know if I can send you the recording. I'll try. Okay.
Oh, okay.
So in Learning Outcome 1, we've looked at what partnership is working, the key elements of partnership working, the importance of partnership working, and barriers, and how to overcome these barriers, and how to deal with conflict. Okay. So these are some of the resources for Learning Outcome 1. The next one I'm going to go through is Learning Outcome 2. Okay. So Learning Outcome 4, Learning Outcome 3, Learning Outcome. Okay, so this is the next one. Can you see this?
I can, yes, please.
So the next learning outcome is to understand how to evaluate partnership working. Okay, so we'll be looking at what partnership working is, the key elements, the importance and barriers. Okay, so 2.1, identify the contribution they can make to enhance partnership working. So like we said, partnership working is two or more groups of people coming together to achieve a goal, a common goal, okay, and they try to work together and with the use of training and resources. What is partnership in health and social care? That's a collaboration between more parties to make sure there's equality and mutual understanding for a specified goal. So partnerships in working in social work. So partnership formed in social work, like we said, is to work together, make sure they work together with different partners. So voluntary community enterprises to make sure they support the NHS England and use the principles of the voluntary community and social enterprise to make sure they use health and social care, health and well-being programs and advisory groups as well. The principles for engagement are be inclusive and reach into communities, challenge inequalities. That's really important to make sure it's diverse and you challenge any sort of inequalities, demonstrate impact and build the evidence base as well. To adopt co-production, be transparent, be open, support everyone, get them involved, be ambitious, challenge and be a critical friend, provide opportunity to engage with them, challenge the thinking, identify ways in where programs are inadequately and inadvertently disadvantaged communities, and they're all working at the same goal. They're all trying to achieve the same goal. 2.1, identify the contribution they can make to enhance partnership. That document looks at things like inspiring great ideas, adding another dimension, sharing experiences, providing essential insights, increasing capacity, providing greater opportunities, helping new audiences, strengthening relationships, greater expertise. So identify the contribution they can make to enhance partnership. So having open communication, like we mentioned, 7, it's really important to liaise with different departments, make sure you look at care plans, make sure you look at patient records and things. Respecting each other, the roles and responsibilities. Why do you think it's so important to respect each other? Should you respect everyone's views and responsibilities and everything like that?
I think so. As long as it's towards achieving common goal.
Yeah, you should be achieving that and being respectful to each other and collaborating with different people, making sure you are collaborating with different organizations. We are setting objectives for staff so they ensure that every member has a role and are aware of what they're accountable for. Having an open mind, making sure you are open to receive training, coaching, things like that. Adhering to the Care Act plan, which is the Care Act 2014 Act, which is that you have a duty in relation to assessing person's needs. You need to make sure you are adhering to that law. Also, being non-judgmental. It's really important that we're not judgmental. Everyone makes mistakes, and we need to provide training and coaching for that person and not be judgmental. Negotiating, so me being able to negotiate tasks with partnerships, being assertive, being confident, and working in a team is really important. 2.2, evaluate their strengths and weaknesses in relationship in partnership working. So strengths is a range of skills available, coordinated service for service users, efficiency, effectiveness, better accessibility, shared goals. Weaknesses, compromise may be required, integration may be difficult, different agencies and discrimination. So conflict can be looking at issues objectively, how you can resolve these issues, how you can work as a team to resolve these issues if they arise. Different techniques, define the problem, determine the causes, generate ideas, select the best solution and take action. Bargaining, so decide who is going to do what task and have open negotiation. Comparative conflicts, so make sure you contribute to effective problem solving, making sure each party knows what their goal is, and challenging any sort of discrimination as well. And then evaluating. Overall, a good evaluation system is good to have in place. So appraisals, feedback, and monitoring things. It's really, really important that you get feedback and monitor things and evaluate towards the end. And then put together a development plan to establish, that you have the same goal at the end of it, and you're working as a team together to make collaboration better and challenging things. So approaches to partnership working: be clear and honest from the start. Never agree to something that you can't deliver. And the best partnerships are built on strengths. Don't get into partnership just to attract funding. Understanding of partnership working. So the aim is it needs to be agreed, understood by partners. Clarity, and the partnership needs to have an effective leadership goal. 2.3, identify ways to improve your own practice. Make sure you could do a SWOT analysis, to carry out a SWOT analysis on yourself, your strengths, your weakness, your opportunities, your threats, and this will identify how you can improve, yourself. Look at your own contribution, what your targets are, what you're missing, what training you're missing, what are your time management skills like? Are you organized? Are you a chatty person? Do you think you've got too much responsibility? Are you too relaxed? It's really important to do a SWOT analysis on yourself. What is your leadership style? So there'll be different leadership styles that you'll fall within, and you could identify that. It may be visionary, you may be a servant, you may be autocratic, you may be democratic, you may be transformational. That diagram identifies what you think your leadership style is. So do you take on too much? Why do you think it's so important to identify these things about yourself, Segun?
In order to know the approach you will give to your approach of managing.
Yes, yeah. It's really important to do you take on too much? Are you a people person? Do you like to say no? Do you like to delegate? Reflect on your practice. Look back at the past month. Look at your areas of improvement. Think back about what you could change. How would you change it? And how would you carry this out? 2.4, explain how to review the effectiveness of partnership working in achieving the agreed outcome. So partnership, like we said, comes in all sizes and all shapes. And you need to have a common vision. You need to share the risks and be working together as a party. So here are a few tips. Do you have a good communication system? Good at feedback, constantly, working together? Is it good or bad impact on your services? Feedback from families and service users. Have you met your agreed outcomes, or are you on track? Has a review of your care plan been made? And also look at the different points. So here we've looked today at learning outcome 2, at the contribution that are made to enhance partnership, strengths and weaknesses, ways to improve, and any points that would review the effectiveness of partnership. And these are some of the resources that you could use to help you. So you'd right click on the resources and it would help you. Okay, so that's learning outcome 2. Quickly going on to learning outcome 3. So we've got to go on to the assignment discussion. Share learning outcome 3, and learning outcome 3 is to understand how to evaluate partnership working. So we'll look at the role, responsibilities, conflict, evaluate and development plan, your own contribution and your measure. So key principles of partnership evaluation: mutual goals, your roles and responsibilities, communication, trust and respect, and decision making. The evaluation methods: feedback and surveys, which are really important, KPIs and outcomes, and case reviews or audits and meetings and reflections. The indicators of effective partnership working, and then barriers to effective partnership working, improvement strategies to put in place, and examples of scenarios there as well. 3.1, explain the contribution learners can make to enhance partnership working. They can understand their roles and responsibilities. It's really important that learners understand their contribution, their roles and responsibilities, so that they know what they are doing without any confusion and disruption. Collaboration and open communication. Again, collaborating with different members, different teams, and having open communication is really important part of any job role, okay? Accountability and setting objectives, following your assigned tasks and making sure you are contributing and reliable, organized and willing to learn. Being assertive, negotiating with confidence, speaking up, and making sure you are respecting others' views as well. And confidence grows with knowledge, and you are willing to participate in that. Following the care plan and making sure the Care Act 2014, making sure you're adhering to this. making sure that you are, you know what the legal duty is when you're working in health and social care. And effective teamwork. Make sure you work together, as it says, as a team, give each other feedback, trust each other, and there's mutual respect with each other. 3.2, evaluate your own strengths, weaknesses in relation to partnership working. Conflict resolution and problem solving, to stay calm. It's really important to stay calm if any conflict arises. Make sure you are comfortable with bargaining, talking with each other, and making sure that you are trying to avoid any sort of issues where there's conflict and it's going to cause problems. Challenging discrimination and reporting concerns. It's really important you challenge these, and if there's any sort of concerns about any sort of race or gender, disability or anything like that, you are reporting that to your manager as well. Evaluating performance and using feedback. Feedback's really, really important in any scenario, because it makes you a better person, and it also makes you identify if there's any improvements. Monitoring by external regulators. Now, you working in health and social care would be regulators such as CQC, which is the Care Quality Commission, and they would be the ones to make sure everything is safe and that you are doing your work properly and you are checking all regular documentation all the time. 3.3, describe ways to improve your own practice in relation to partnership working. Improving your own practice, developing, understanding, effective collaboration, knowledge, training. You're putting together a development plan. This is really important if you look at putting together a development plan for yourself. Why do you think it's so important, Segun, to put a development plan in for yourself?
When you have a development plan, it helps you to gain more knowledge without conflicts.
Yeah, and you'll have a plan there, won't you?
Making.
Yeah, you'll have a plan there, so it sets your, what you are expected to do. So establish and maintain working relations, develop approaches, improve your partnership, set smart targets for yourself. Making sure you're putting together a plan so it's easily done. 3.4, the effectiveness of partnership working in achieving the agreed outcomes of working together. So reviewing your own contribution and your leadership style, reflecting on your own practice, regularly reflecting what is my role, what am I expected to do, measuring the impact on service users, and reviewing the care plan. So we've looked at reviewing the effectiveness of partnership and your own role and leadership, monitoring service delivery, evaluating the progress, and also care plans. These are the references for learning outcome 3. The next one we're going to go through is learning outcome 4. Sorry about that. Learning outcome 4. Learning outcome 4. So learning outcome 4 is to know how to work with others to support organizational innovation and growth. Why do you think innovation is really good?
Yeah, it makes work easier.
Yes, yeah.
Like all this the care plan and everything can be done electronically.
Yes, it's really important.
And so information can be transferred easily and without any delay.
Yeah. So the indicative content is skills and knowledge required. We look at the involvement of stakeholders, so it could be people from the outside, shared goals and forward planning. So how to work with others to support organizational innovation. So here we'd look at understanding organizational innovation. So introducing new ideas, new methods, improving how the organization operates, introducing new technologies, creating more of a communication between teams, adapting services. So the role of teamwork in driving innovation. So we have diverse perspectives, making sure we have shared ideas, supporting for risk tasking, problem solving, supporting change and adapting to it. So innovation requires change and we can create resistance, being open-minded, contributing in discussions, giving feedback, supporting other team members. Examples of collaboration supporting growth. So in health and social care, a care team introduced a new digital system. So staff need to learn about that. They need to be trained, to improve this collaboration. Communication, leadership, and continuous improvement to work effectively together, to take on new initiatives, communicate together, reflect on what's been done, and encourage others to contribute. So 4.1, describe aspects of an organizational that are no longer effective in providing a person-centered service. So person-centered being put the individual's needs, preferences at the center of everything. So outdated policies. Many organizations rely on outdated policies. When policies, are outdated, it's ineffective, isn't it? The policies are not, if a policy is outdated, it's not going to be effective and it's not going to be up to date. So there's going to be risks involved. So make sure all the policies and procedures are up to date. Poor communication channels when staff don't communicate with each other. What do you think that what happens when staff don't communicate with each other?
There will be I don't know how to put it. No, passing information. There will be
confusion, wouldn't there? There would be a breakdown of communication. Yeah.
Yeah. In the
It stops.
Yeah,
the person can't work together. There's no trust, and it's poor communication. Limited staff training on personalization. So, one fits all approach, focusing on, everyone is different, is ineffective. You need proper training for your staff. Rigid schedules and routines. In some, you've got strict routines. You need to make sure that you have key principles in place because it's ineffective. Lack of service user involvement in decision making, making sure the care plans are person-centered towards that individual, making sure there's outcomes for that individual rather than not getting them involved. Ineffective use of technology, it doesn't rely on paper-based system. It causes delays, the risk of errors. So everything has to be updated. 4.2, again, improving or growing a business depends on collaboration. No one can drive meaningful alone. It requires a range of different people. So it could be internal staff, external staff, families, patients, service. So there's gaps between that. So involvement of key stakeholders include frontline staff, service users and their family, managers, decision makers, GPs, doctors, nurses, social workers. So team meetings and communication are really important to raise any sort of concerns, review any sort of matters, identify any barriers or suggest any new methods as well, brainstorming. Shared goals, having a shared goal, people working together is clear and measurable, and, making sure that they're setting goals that align with the team and the department. Clarifying roles and analyzing service delivery methods. Comparing outcomes to objectives, finally to identify, make sure you redesign your team and make sure, there's objectives in place. 4.3, describe how to maintain a culture that supports innovation, change and growth in relation to service provider. Sharing goals, making sure you're sharing goals with your organization, your team members, and keep them motivated with different ideas. Identifying innovation ideas, listening to team members. It's so important to listen to your team members. Shared responsibilities and delegation, and clarity on roles and adapting. This is just a summary of what we've gone through. 4.4, how to maintain a culture that recognizes resources available for the expertise of those using and working in service. So valuing staff expertise, and that's really important to value your staff, encourage contribution, make sure, you offer different development opportunities for that staff member, involving service users and their family, making sure they're involved as well, doing surveys, getting feedback from them, encouraging peer learning, peer mentoring, staff cross-collaboration, building respect in everyday practice, so giving credit, listening to people, leadership and commitment. Leaders and managers set this tone, consult your team members. It's really, really important. And a summary of what we've done there as well. 4.5, explain the importance of entrepreneur skills in ensuring the market can meet future demand for adult services. Forward planning. It's really important to forward plan, anticipate future trends, prepare for increased demand, make sure you are also currency and validity of service. So make sure it's up to date, responsive, and using modern tools. Becoming a market leader, being the first to try any sort of new models, flexible working hours, offering specialist service, building this quality service and becoming a market leader. Awareness of opportunities and threats. Opportunities such as new funding streams, partnerships or unmet needs, and threats like cuts in local authority. And then a summary in regards to entrepreneur skills. These are the references for learning outcome 4, and this is the final learning outcome, okay? So the next bit I'm going to share with you is the element of the assignment discussion. Let's see if I can find the assignment discussion here now. Assignment discussion. Okay, so let's share the assignment discussion. So where is it? Where's the assignment discussion one? It's over there. So let's just share. What is this? Let's have a look. Can you see this? Stop sharing. Let me see if I can open the assignment discussion. Desktop working. Working in partnership. Discussion. Is this not opening? Open. Let's have a look. Don't know if you can see that. Can you see this?
Not yet.
You can see it now?
No, not yet. No.
Okay, so where is it? Second, Windows. Is this assignment discussion? Oh, yeah. Maybe you can see this one. Second, yeah?
Yeah, I can.
So this is the assignment discussion. So this is what is expected of you in that assignment. So you need to make sure, you're sticking to all the deadlines, and you need to make sure you are on top of things when it's doing the assignment, okay? So useful tips: read the tasks carefully, focus on the details and command verbs, use as guidance, define, explain, describe 70 to 100 words. Your assignment is 3,000 words, okay? Use Harvard system of referencing. Do you know how to use Harvard system of referencing?
Not really.
I can show you a tool later on which will help you, okay? And it's called Neil's Toolbox. So Harvard system is, for example, if you're putting it in the main text, you use author, date, and then towards the end, you would use the full citation, okay? Word limits is 3,000 words for this essay. Assessment, theory, application, example, assessment, different types. For this unit, you will be doing 2 types, okay? You've got task 1, which is an essay, and task 2, which is a reflective account, okay? So task 1, for this task, you are required to write an essay. The essay must include, number 1, a map or diagram of partnerships involved in service delivery for a selected health and social care provider. This may take a form of a diagram or written account, okay? So you could do this, and it could be the form of a diagram or a written account, okay?
Okay.
So so this is giving you an example, okay? Can you see that?
Yeah, I can.
Yeah. So then task 1, you would look at also the health and care system from April 2013. So task 1 essay. Here, number 2, you look at a description of key elements of partnership working with external organizations. What we've just looked at, like external organization, we looked at colleagues, we looked at the individual, and we looked at families. And that's looking at learning outcome 1, AC 1.1, okay, to do that.
Okay.
You understand that, Second?
Yeah, I do.
So you'll be looking at learning outcome 1, AC 1.1 to answer that, okay?
Yeah.
So you look at external organization, you look at colleagues at work, you look at individuals, and you look at families. The third bit, so there's task 1, you've got 3 parts. So the first bit of task 1, you do this, yes? Second?
Yeah.
You will look at this. Can you see it, yeah?
Yeah, I can see it, yes.
Yes. So first part of task 1 is an essay. You will do this. You look a map of diagram of partnerships. The second part of task 1 is looking at a description of key elements of partnership working with external organizations, okay? The third part of task 1, don't change the wording, leave the wording as it is, okay? The third part is an evaluation of the importance of partnership working with external organization, colleagues, the individual, and families. And here you look at AC 1.2. So you look at learning outcome 1, okay? But you will be looking at AC 1.2. Okay?
Okay.
So when we looked at the assignment, it was looking at AC 1.2. We're looking at the importance of working with external organization, colleagues, and the individual and families, okay?
Right, okay.
So this is all part of task 1. Then part of task 1 again, there's another bit, 4, number 4. Do this as a heading and put the answer under it, okay?
Okay.
So here you're doing an explanation of how to overcome barriers of partnership. And that's looking at AC 1.3, okay?
Okay.
This is all in learning outcome 1.
All right.
The 5th part is an explanation of how to deal with conflict may occur, and that's AC 1.4, okay? So this task 1, it covers learning outcome 1, okay?
Okay.
It covers 1.1, 1.2, 1.3, and 1.4. Okay?
Indicative word
Are you
count.
okay for that?
Yeah, I'm okay. I'm okay.
And the word count for task 1 is 3,000 words. Okay?
Okay.
So you've got enough wording there to make sure it's 3,000 words. So you've got 5 tasks to do for task 1. 5 parts, okay?
Okay.
Don't change the wording. If you put this as a heading second and write the answer under it, okay?
All right.
That will make it easy for you. Don't change any sort of wording or anything, okay?
Okay. So the same goes to all of the tasks.
Yeah. There's 5 tasks, isn't there? If you
So
go
like
back,
this number 2, that number 2.
that's number 1 here. Look, task 1.
Yeah. So I can write
Just copy
this.
that. Copy that out. Just copy that. Yeah.
All right. All right.
Put that as a heading. Then put the answer under it. Then number 2, put this as a heading. Put the answer under it. Number 3, put this as a heading. Put the answer under it. Number 4, put this as a heading. Put the answer under it.
Okay.
And number 5, put this as a heading and put the answer under it. And this is all learning outcome 1, AC 1.1, 1.2, 1.3, 1.4. It's wrote it here for you, what it covers, okay?
Okay.
And it's 3,000 words, okay? So that's task 1, okay? Task 2, okay, is separate, yeah?
Okay.
It's a reflective account. What's a reflective account? What does a reflective account mean?
That's from your own
Yes.
personal,
Yes.
personal.
Yes, your own experiences, your own actions, and what you do well and what you learn from the future, okay? So this is task 2. So that was task 1. Do you understand? Yeah, it's a good.
Yeah, I understand.
This is task 2. So task 2 here. Your reflective account should include, number 1, the contribution you make to develop and improve partnership working. And that will be looking at 2.1, learning outcome 2. Okay, so for this, you will be looking at learning outcome 2. We gave you some examples in there that you could look at as well, okay?
Okay.
So that's the first part of learning outcome 2, task 2. And that's the second bit, an evaluation of your strengths, weaknesses in relation to partnership working. Could you look at SWOT analysis there as well? Yeah?
Yes, please. Yes.
So you could look at that. That would be learning outcome 2, 2.2. Okay?
Okay.
Then you go on to, so there's, in learning outcome 2, there's 4 parts. So the third part is ways to improve your own practice through preparing a development plan using the outcomes of your evaluation in item 2. So here you will look at AC 2.3. Okay? And that's learning outcome 2. Then the fourth bit of task 2, you will how to review the effectiveness of partnership working in achieving the agreed outcomes. And that's AC 2.4. Okay, that's learning outcome 4. Learning outcome, 2.
So on all of this under the reflective accounts, I have to base my answers on my own.
Yes, on your own reflection. On your own reflection. Yeah, look, a reflective account is a written description of any experience, your actions, what went well and what have you learned. So it's on your own, but you need to take into account these ACs and the learning outcomes, okay? You need to refer to these. So there's 4 parts. 1 part for task 2, 2 part for task 2, but refer to the learning outcomes. 3 bits of task 2 and the 4th bit of task 2. But it shows you at the end what AC you need to refer to.
Right.
So task 2, your reflective account, covers AC 2.1, 2.2, 2.3, and 2.4. And for this, you need 1,000 words. So altogether, you need 4,000 words, okay?
Okay.
So for this one, because it's a reflective piece, it's only 1,000 words. So what I would do, because there's 4 parts to task 2, I would do 250 words for each one second.
Oh, okay.
Okay, 250 words for each one.
Right.
Okay, for each bit. So task 2, sorry, 250 words, 250 words, 250 words, and 250 words. Okay?
Okay.
Make sure you don't go too much over. Okay?
All
You
right.
have 10% flexibility, but don't go too much over. So have you got any questions around the tasks? So you've got 2 tasks. Task 1 is 3,000 words. Task 2 is 1,000 words. Have you got any questions around them tasks?
No.
Are you sure?
Yeah, I'm sure.
Okay. So assignment presentation, make sure your document is structured and formatted. You've got good practice. Make sure you've got the headings, the tasks as I showed you. Right, just copy and paste them out and write the answer under it. Okay? Start with a bit of an introduction at the start, maybe 30 to 50 words. Write your learning outcome and then, put the answer under it. Font size 12 and line spacing, so 1.5 line spacing. Page numbers to be inserted, make sure you put a table of contents, and then a basic conclusion at the end, and reference a bibliography. Make sure you are sticking to the word count. Make sure you are not using AI. You have a 20% threshold for AI. Anything over that would be plagiarism. And plagiarism is really, really important when it comes to doing your assignment, because if you plagiarize, you would be done for academic misconduct. So make sure you are referencing your work, okay? Referencing is really important. And if you have any questions or anything, email learnerwork@ukvarsity.co.uk. Your assignment must be submitted on learnerwork@ukvarsity.co.uk. So when you are doing your assignment, you need to sign a statutory declaration, which is available on Moodle for you to say that you haven't copied the assignment. The whole assignment is your assignment. And any sort of plagiarism issues, that you've looked at the plagiarism policy online as well. You need to make sure you are doing everything as according to what they're asking you. You don't change any of the wording. Put each one as a heading segment and write your answer under that. Okay? And make sure you are sticking to the word count. So task 1, again, 3,000 words. There's 5 parts to task 1. So have a look at how many words you want to do, 600, 700 for each one, 650 for each one, and then put them as a heading and write your answer under that. This is helping you to tell you where it is. In learning outcome 1 is task 1, learning outcome 2 is task 2, and it identified there. So you could use that to help you and guide you, okay?
Okay.
So do you have any questions?
No questions. No.
Excellent. If you have any questions, email learnerwork@ukvarsity.co.uk, and make sure you are sticking to the guidance, plagiarizing, declaration form. Make sure you are sticking to the font size. Make sure you have a table of contents. Make sure you are not copying and pasting, and make sure you are doing a professional. Don't use bullet points, okay? Make sure it's a professional piece of work, okay? It's an academic piece of work. No bullet points. Use UK command, English command. Don't use American style English. People sometimes use that. Check your grammar. Put a reference and a bibliography at the end, like a reference list.
What do you mean by I shouldn't use bullet points?
Yes, sometimes using bullet points when you answer it, it's not answering the question, is it? Bullet points.
Okay.
You're on level 5, yes.
Oh, you mean it? Yeah, it has to be detailed, not
Yeah,
just.
yes.
Okay.
This is bullet points. Can you see this? This is all bullet points. Your assignment shouldn't be in bullet points like this.
Okay.
Okay, your assignment should flow like an academic piece of work. It should have more structure and flow. It shouldn't be bullet points. That doesn't answer the question. So when you're talking about your ways to improve it, you would write under there continuously. Do you understand?
Okay, okay, I
You
get what you
wouldn't
mean.
put bullet points in, okay? And it needs to flow, it needs to make sense, it needs to be an academic piece of work. You need to have a reference list. You know, at the end of each learning outcome, we had a reference list.
Mm.
You need to have a reference list and you need to use the Harvard system of referencing. Do you want me to
Yeah,
show you the
please.
website?
Yeah, please.
Okay, I'll show you the website. There's a website you could use. It's called Neil's Toolbox. And this website would help you do Harvard referencing, okay? And it helps you with internet, it helps you with everything. And there's other websites on there as well, not just this website, okay? So I'm going to just share this with you. So you've got a little bit of an idea what it looks like, because it's quite an interesting website to use. Can you see this? It says Neil's Toolbox.
Near.
Harvard referencing generator. Can you
Okay.
see it?
Yes, please. Near toolbox.
Yes. So it's called Neil's Toolbox, and you've got, so let's just, you can reference a book, you can reference a website, you can reference anything on here. Let's reference a book, okay? So book title, Working in a Team. It's just, I'm just guessing, okay?
Okay.
In a team, okay? The author, so the author would be their surname first, so Miller, and then their first name, S, okay? Publisher, this will all be found in the book, Peacock, okay? The place of publication could be Oxford, and that would be found on the first page of the book. The year of publication would be 2025. The edition of publication could be fourth edition. And then can you see that it says generate reference?
Yes, please.
Press that. Look, it's done it for you. Can you see it's done it? There. It's put it in the order for you.
Okay.
It's put all the
So,
details. I put all the details in and it's made it for you. Do you understand?
okay.
So what you do with this is you copy this and paste it into your reference list or bibliography at the back.
Okay.
So
So,
whatever you use, if you use the internet, you would do the same for the internet. You would do the same for the books, and you would copy and paste this into the back of your bibliography, because at the end of your assignment, you need a reference list or a bibliography.
okay.
Okay, so you would just put any details in that you find. So for example, if you're doing let's do a website, okay, from the internet. So let's just put Red Cross, okay? This is example for you. Article detail could be human rights, yes.
Okay.
Website could be, let's just take that website off there. This is the website name, could be Red Cross, okay? Then it would be when it was published, maybe 20th of December 24, okay? I'm just guessing this, okay? So the year published could be 2024, 2025, let's take this out. And then the full URL, you'll just copy and paste. Can you see that address at the top?
Yes.
Just copy that and put that in there, okay? Once you put that in there, generate reference. Look, it's made it for you. Can you see that? All the information I put in.
Okay.
It's made it for you. Then you would copy and paste that and put that in your bibliography at the end.
So what if all of my answers come from my own initiative and based on what I've read and based on
That's okay. You could
experience?
reference if you reference the slides and you've used the slides, you'd put UK Varsity slides there and reference them.
Okay.
And put the page number, but try to use a little bit of internet sources or a book or something. You don't have to, but it's good to have a bibliography at the end.
All right.
It shows you're thinking outside the box.
Okay.
And you can use this Neil's Toolbox for anything, any of your assignments, okay? This is really good for everything. This is the Harvard system referencing generator.
Okay.
Okay, and you'd use this for everything. Now, you could submit your assignment. You have 2 weeks after today to submit your assignment. And you would submit it on learnerwork@ukvarsity.co.uk.
I have 2 weeks.
I think you have 2 weeks, but if you need extra time, Segun, you need to email learnerwork@ukvarsity.co.uk. They will give you extra time.
Oh. I thought I was meant to do it at my own pace.
I think normally you would get 2 weeks, but you need to speak to them. Okay. You need to email learnerwork@ukvarsity.co.uk.
Okay.
Okay. If you have any questions around it, if you don't understand anything, ask me now, and I will go through it with you. But I think, if you've got any questions or anything around it, just email them as well.
No, I don't have any question. I don't have any questions at the moment.
And then all the resources are available on Moodle for you. Any additional resources, this recording will be available on Moodle for you as well, second.
Okay.
So this recording will be available on Moodle. All the resources, all the slides are available on Moodle for you. If you go onto this unit, any sort of additional reading is available on Moodle for you.
Okay. Because
Okay.
I do work, and I've got family, so I didn't
Have you
know.
got access to Moodle? Yeah.
Yes, please. I do. Yeah.
Okay. Okay. Do you have any questions before we finish the session off,
No,
Sagan?
no, I don't have any questions
Are you
as of
sure?
yeah, as of now. I don't have any questions.
I quickly went through the learning outcomes. So I went through learning outcome 1 to 4 quite quickly, but you can have a read of them in your own time in more detail and watch the videos and any sort of links that you've got. You can go on to that additional reading, which will help you, support you as well when doing this assignment. So make sure you stick into the word count. 3,000 words for task 1. For task 2 is 1,000 words because it's a reflective account. Make sure you read your tasks carefully on what they're asking you and referring to learning outcome. Task 1 is referring to learning outcome 1, and task 2 is referring to learning outcome 2. So make sure you're reading around that, and make sure you are sticking to what you are being asked and sticking to the avoid using things like AI, because it'll get you plagiarism, but maybe work around reading some of the sources on there, and also working with the learning outcomes as well.
All right, cool.
Okay, so good luck, Sagan, with doing your assignment. And it was lovely teaching you. And if you have any questions, email learnerwork@ukvarsity.co.uk, and access to your slides and everything will be available on Moodle for you.
Okay, thank you very much.
Okay.
Thank you. What part of the module will I get this video, or
this will be on? I will see if I can email it to you, Sagan. What's your email address?
It's sierra.oscar.
1 minute, let me just see. Sorry.
S.O.
Yeah.
Dot Adegoke, Adegoke.
So S.O.
Dot.
Yeah.
Alpha.
Yeah.
Delta.
Yeah.
Echo.
Yeah.
Golf.
Sorry?
Golf.
Go.
Golf.
G-O.
G. I'm using this generic acronyms to. That's
okay. Can you put it in the chat?
Okay. I can
put it in the chat, and then I can see if I can send you what I can send you. I might be able to send you the recording. If not, you could contact them on Monday at Learner Work, but I'll try and send you it if I can.
Yeah, that's it.
Oh, let's have a look. Oh, so it's got it. So it's as.adi gmail. Let's have a look. So let's have a look. Paste. Can I just send you a message? Hi. Can you see if you got that message?
Not yet.
Now? Check it now.
Okay. Let me check.
Have you got the message from me?
1 sec, please. Yes. Yeah,
excellent. So can you message me back with what you want, what you need, the PowerPoint slides and things? I'll send you the slides, okay, Sagan?
Okay, thank you.
Okay. Any other questions, email learnerwork@ukvarsity.co.uk, and good luck with getting on with the assignment, okay?
Thank you.
Thank you. Thanks a lot. Lovely teaching you. Bye.
Thank you. Bye now. Bye.